Andrew Hamilton, COO of Alliance of Chicago. Hi, Mark and Andrew. Can you tell us about Alliance of Chicago?
Sure. We are an organization located in the city of Chicago that provides electronic health record system and health IT services to federally funded community health centers that serve uninsured and underinsured citizens of the city of Chicago.
In your role as COO, did you have to choose an electronic health record system?
Yes, our organization went through a vendor selection process, and I was involved in leading that effort with the organization's CEO.
And because I'm sitting here, I see you chose Centricity Practice Solution. Why was that the right solution for you?
Fundamentally, the solution offered us two very important things. One, it allowed us to build the screens that the clinicians and staff use to meet the workflow considerations of that organization. And secondly, and perhaps its biggest strength, is it's an application that allows us to collect and manage data in discrete fields that we can use for reporting and monitoring performance and safety in our community clinics.
How have your physicians liked the adoption of this technology? Has it been an easy transition?
Well, as probably many in the industry would report, the transition from paper to electronic is challenging for everyone. This particular product, I think we found users of the system think it's intuitive, so it's easy to use, it's easy to learn. They find that the clinical screens contain all the information that they need to document, which is very important for the organization. And yet we balance that with this need to bring all that data together in a structured way to look at our population as an aggregate cohort. And so that's always a challenging balance when you're doing an implementation of any EHR. We think that the GE Centricity product offered the best of both worlds. Easy to use, but yet structuring that data for reporting and decision support.
Mark, Dr. Denton, how closely do you work with a client like Alliance of Chicago?
You know, Alliance of Chicago is a marquee example of how to really think about the value of electronic health records and how we're going to really take care of patients going forward. We work extremely closely with Alliance and with Andrew specifically. We have a research program going on right now with the Center for Disease Control, the Chicago Department of Public Health, and Alliance of Chicago, utilizing our technology and standards. So the other theme of our show here is standards and interoperability of data. So it's that ability to take in information, make it available for the clinician to use, but then also have knowledge management performed on that information to help provide guidance. You know, one of the great examples we're using right now is foodborne illness. You know, any good EMR should be able to give you the diabetic foot exam protocol, right? Hasn't changed, not going to change. But if you really think about what we can add value to and why our system is so flexible and with its enterprise data warehouse for getting this data, we can take something as transient as the local restaurant down the street might have a salmonella outbreak, and these guys are seeing it within 2 digits of a zip code, and we want to get that data to other people so it can be acted upon. And those are some of the research that we're doing. On the real pragmatic side with what Alliance does, they serve a population that is just, you know, what we want to do is to do the right thing because it's the right thing to do. You know, when we start to think about disparity of care and the role that Alliance plays in providing that care, you know, it makes us proud to be able to be supportive of them.
So you're serving the disenfranchised.
Yes, the uninsured and underinsured folks in the city of Chicago. We're considered a safety net organization that's really caring for some of the most vulnerable populations in the city.
Well, I like that a lot. Could you give us a short demonstration?
Sure, so just to illustrate some of the points I was talking about, you can see here I'm in the chart. Right on this summary page of the chart, I have all right at my fingertips, all of the current problems, medications, allergies, advanced directives, and care alerts and reminders. Those are decision support prompts that remind me as a clinician how this particular patient, I need to address certain items that they're overdue for or might be having due in the near term. I can get into detail by opening these tabs up and looking at much more detail under them by just clicking some boxes, those buttons I can move around with ease. It's a very intuitive, simple to use system. And then I can also then document all of these different types of visits. So a clinical setting will have different types of workflows based on the need of that patient. And so there's examples there and I'm able to use these to document their care. And then when I want to look at data that I've collected at a quality level and aggregate this data, I can see right here with simple indicator, I have 30 diabetic patients. Of those 30, they're meeting hemoglobin A1C control, but I haven't done the appropriate laboratory monitoring that I had hoped to do. I can click on that button and I can get a list of those patients that are overdue for those activities. So these are my 30 diabetics that I'm responsible for, and right here with 2 clicks of a button, I know these are the folks I need to be targeting. And in a new paradigm of care, accountable care, healthcare reform happening, it's very important that these types of systems also introduce those workflows, because it's not just about the patient and the doctor anymore. It's about the system of care caring for a community of patients. And that's really how powerful this tool is.
Very well said. Is there a mobile application for this?
There is actually a version of this very product that I can access from an internet site, and that allows me, if I'm at home taking call or if I'm in the hospital rounding on patients, an appropriately secured mobile application consistently following all the privacy and security standards in the industry, but yet allowing me to access that information.
You know, this is one of the technologies that we're really proud of. We've had electronic health records at General Electric for a long time, but this particular application had a significant input of, you know, hundreds and hundreds of use cases put in. This application go from the single doc practice to how many clinicians are actually using?
Great question, Mark. We have over 300 physicians, nurse practitioners, and physician assistants using this system at any one given time.
And we actually have customers that are even larger than that. What was interesting is that this in essence is a very enterprise scalable solution, and yet we have over 40 specialty technology, specialist formats of the same technology, but now they can get their view. So the orthopedic surgeon will have their view, the ophthalmologist will have their view, all feeding the same enterprise data warehouse that has over 25 million lives in it, that we can now start to not only look within the institution that Andrew critically pointed out in payment reform, but also now as we start to take care of community of patients, how do we make sure that they're benchmarking the right and most appropriate care? And we now have a data set because of what we've really started almost 7 years ago that really is allowing us to really optimize patient care right now. I'm really proud of this.
How does this system help physicians achieve meaningful use 1?
Sure. Well, from our perspective, if you've followed closely the meaningful use, I've been calling them test questions lately. Things like there must be a structured problem on a problem list, a structured medication, online order entry, electronic prescription of medications. All of those features are in this product, in the product you're looking at here. I don't have to use 3 different systems to do that. I can meet all of the requirements of meaningful use by this one product. And most importantly, I'm able to, as you can see here, I can look at all of the meaningful use measures, and I can see that my organization currently is in alignment and has passed those test questions for stage 1 just by looking at this. And that's very important, because managing clinician adoption of technology doesn't mean give them a computer and turn it on and train them one time. It's a system that needs to be reinforced, and this tool, this reporting tool, makes it very easy to identify your problem areas and launch some institutional interventions to fix that, to ensure the use of the technology is consistent with its design.
Very impressive. I thank you both so much.
Well, thank you.
I'm Ann Fishman at the GE booth HIMSS 2012. Thank you.